Hi, everybody. Dr. Daniel, and today I'm speaking about triptans and heart disease risk. Triptans should not be used in patients with previous cardiovascular risk, myocardial infarction, or stroke. Triptan use with other patients is okay and benign. So, the history of triptans for migraine, they first came out about 1990 in an injectable form as Imitrex 6 milligrams subcutaneous. This application was named generic as sumatriptan was always considered the highest dose of any of the triptans, which gave 100 milligrams of medicine in the brain and the fastest dose, 10 minutes, when given subcutaneously. After Imitrex, there are 5 other triptans introduced. The list of current triptans is Zomig, Zolmitriptan, Maxalt, Rizatriptan, Axart, Almatriptan, Relpax, Elatriptan, Emerge, Naratriptan, and Frovatriptan. These comes with different size doses and different applications and times of use. The pharmacologic action of triptans is that they activate serotonin B, HT1B, and 5-HT1D receptors, producing cranial vasoconstriction and inhibiting pro-inflammatory neuropeptide release. Particularly, they stop the release of CGRP, which is now known to be one of the very inflammatory neurochemicals released during the migraine process. Warnings for triptans. Early clinical studies reported that triptans produce problems in persons with previous myocardial infarction, stroke, hypertension, or cardiovascular risk. The current list of FDA contraindications for triptans is history of coronary artery disease or coronary artery vasospasm, Wolff-Parkinson-White syndrome or other cardiac accessory conduction disorders, history of stroke, transient ischemic attack or hemiplegic or basilar migraine, peripheral vascular disease, ischemic bowel disease, uncontrolled hypertension, recent, within 24 hours, use of another HT1 agonist, that is, like another triptan or of an ergotamine-containing medication. Current or recent, in the past 2 weeks, use of a monoamine oxidase A inhibitor. Hypersensitivity to Imitrex, such as angioedema and anaphylaxis being seen. And lastly, severe hepatic impairment. Warnings and precautions regarding triptans are myocardial ischemia and infarction and Prinzmetal's angina, arrhythmias. We should continue Imitrex if that occurs, chest, throat, neck, jaw pain, tightness, pressure, or heaviness, cerebral hemorrhage, subarachnoid hemorrhage, or stroke, gastrointestinal ischemic reactions, and peripheral vasospastic reactions. Now, the other side of this is that triptans work better and faster than the new acute therapy migraine treatment drugs. And a recent study has found that the newer developed acute therapy drugs for migraine do not work as well as the triptans. The new medication drugs for migraine considered for this study are the CGRP inhibitors such as Nurtec, which is Rimegepant, Ubrelvy, which is Erbogepant, and Rayvow, which is Lasmiditan. I have an article on that and a YouTube video on new migraine drugs do not work as well as triptans 2024, which you might listen to see that part. Now, there's a new article on triptan use in heart disease published in February of 2024, and they mention again the risk of stroke and myocardial infarction among initiators of triptans, which has certainly been a problem. This was a study done with nationwide in Danish registration, and the authors asked this question, quote, is the use of triptans associated with ischemic events to an extent that warrants current contraindication in patients with ischemic risk factors? Findings in this case crossover study included 429,612 individuals. Triptan use was associated with a higher risk of ischemic events, but the risk for the individual user was very low. Patients with ischemic outcomes generally had a profile of high cardiovascular risk. The meaning of these results suggests that avoiding triptan treatment due to concern of triptan-associated ischemic events is rational in patients with a high-risk cardiovascular profile. In total, 11 people had myocardial infarction with their first triptan prescription. 18 people had ischemic stroke, and 35 people had ischemic or unspecified stroke. Nearly all the people with an ischemic event had cardiovascular risk factors, and their median age there was about 60. So the authors stated, the results of this study support the current U.S. Food and Drug Administration recommendation that triptans should not be prescribed to patients with a history of coronary artery disease, transient ischemic attack, or stroke. The study spanned January 1995 to August 2022, and again included 429,000 patients in Denmark who had redeemed their first ever triptan prescription. Now, there are a group of CGRP acute therapy drugs for migraine patients that carry no cardiovascular risk, and I'll go over those again. Ditin, which is Rayvow, Gepant, which is Nurtec, Gepant, Ubrevely, Gepant. But however, it's not felt that those drugs work as well as triptans do. And clinically, it's found that something like 80% of persons who have a migraine will have headache-free experience in 2 hours if they treat early with a triptan. 20% of patients don't respond to triptans anyway. So I hope this review is helpful in showing you and reassuring you regarding the use of triptans in persons who do not have cardiovascular risk disease or factors. Thanks very much for listening. God bless you. I'll see you again on the next talk.